This is Miss X. And tell us about your experience on the internet.
Well, the shipping was fast, but the alignment of the teeth, it does not fit in my mouth properly. It's bulky. They look like dentures. The two front teeth, it goes over to the left, so it's not even aligned properly. I just don't like them.
How much did you spend?
I spent about 1,200, between 12 to 1,300 with
That's
shipping.
a lot of money.
And correct.
Okay, so when you got them, did you like the color? Did you pick the color? Who picked the color?
I picked the color.
Okay.
Yes.
And were you satisfied with the color?
I was satisfied with the color for today's market, but it was just the bulkiness. Everyone think I have dentures on.
So could you eat with them?
I can eat with them.
Okay.
They-
Was your bite correct?
No.
Okay.
No.
All right. Okay, so I'm going to go ahead and explain one thing. First of all, with any type of appliance that you fit over your existing teeth, you have to make sure that your gums and teeth are healthy and they're decay free. The one problem I have with do-it-yourself dentistry is that patients are taking impressions of their teeth themselves. It takes us years to get that technique down. In fact, we send our patients for digital impressions, so they are 99% accurate. So there's no way you can do a do-it-yourself impression. It's just not going to happen to get accuracy. You're not going to be able to get the right fit or be able to have it supervised by a dentist to design it. Let me go ahead and show you the x-rays of this patient. So if you can see, this patient has some broken down teeth in the front of her mouth. And those teeth really need to be taken out before you decide to do any type of appliance or permanent dentistry or even removable temporary dentistry whatsoever. Also, if you notice on her lower left side, she has a broken tooth that's had a root canal. That tooth needs to come out. And you can see decay in her lower anterior teeth. And as we move over, we can see a little bit of bone loss. So here again, we have some root tips. So the problem I have with do-it-yourself dentistry on the internet is that you really don't know what's going on with your teeth, and you shouldn't get this type of appliance. So I'm going to go ahead and show you what these look like. They do look like Snap-on Smiles, but they're a lot bulkier. Now you can't tell this from just looking at them, but we're going to go ahead and try them in. Okay, let's go ahead and try in the lower. Now here are her existing teeth. As you can see, she's got some decay here, and she's been gracious enough, she's Miss X is what we call her, gracious enough to let us use this for YouTube. And she's got broken teeth here and decay here. So we would fix all this before we would ever put an appliance in a patient's mouth. But let's go ahead and place this in. Okay, now it might look pretty good, but it's very bulky, and also these teeth are hidden back, so they don't come out enough. It might look okay to you from a standpoint of a YouTube viewer, but it really doesn't fit quite right. And the main issue is this side here is not aesthetic. But I don't really have a problem with the lower one as much as I do the upper one. So let's go ahead and put the upper one in. Again, she's missing her anterior teeth and they're broken down, so these teeth have to be taken out before you ever decide to get anything placed in your mouth. So here we place this in. It really doesn't fit at all. Am I correct?
Correct.
So the appliance, it just doesn't snap into place like Snap-on Smile. It just doesn't fit. There's a huge gap here between her broken down teeth and the appliance. I mean, I don't know how you can even keep this thing in, and it's very bulky. Now bite down. Here's the killer. Bite on your back teeth. She's not even biting right. So her bite is totally off, and her midline is off as well. So there's, I don't know how you even keep this in.
I have
You use adhesive. Okay, so with Snap-on, it snaps in. We don't even have adhesive. So basically, she's using adhesive to try to keep this in, and it's bulky, and they just don't fit right. So
And also when I eat, the food goes behind.
stop.
Also, when I eat, the food enters behind the whatever that's called.
Well, it's just there behind the appliance.
Yeah,
because
the
it doesn't
appliance.
Fit. It doesn't
Yeah,
fit
so
over
the
your
food
existing
goes
tooth.
every time I
Exactly.
eat. I take it out and rinse out the food that fell in between the appliance.
So if you had to do it all over again, I mean, you're here in our office. If you had to do it all over again, would you do this
No,
appliance
never.
again?
I don't suggest
Okay.
for nobody.
So she's here for Snap-on Smile, and I will tell you, for the Snap-on, she is better off really with probably an upper removable cosmetic partial on the top, because she has a little bit too many missing teeth on the top to be able to hold a Snap-on in place. But her lower, I think we can, after we get her dental work done, I think we can do a really good Snap-on Smile for her. So, thumbs up or thumbs down
Thumbs
for
down.